My name's Neil Rawlins. I'm an OBGYN physician in Richland, Washington. I'm currently at Kadlec Health Systems. I am working part-time as an OBGYN and part-time as the Chief Medical Information Officer. I first learned about Isabel in about 12 to 14 years ago. I was looking for a program to help me with making diagnoses on patients that we struggle with, that nobody knows for sure what they've got, and was very intrigued by the use of symptoms to help me come up with a differential diagnosis. Many of the resources out there are libraries that, if you know what the diagnosis is, they have a great reference for what to do about it, but there are really very limited resources to help you in making a diagnosis so that you know where to go in their both evaluation and treatment. So one of the problems we have in medicine is that if you look at a patient that walks in my exam room, 65% of the time when they walk out, I've got the right diagnosis for them. That means 35% of the time I'm wrong. If you've got the right diagnosis, then you can find a treatment that's effective rather than, well, let's try this, well, let's try this, well, let's try this. We can say, okay, now we know what you've got, and these are the best things to try. So most of our references that we've used over the years only told us what to do if we knew the diagnosis. So if we don't know the diagnosis, most of our references in medicine today don't help us. This is one that helps us in those cases. I've been very vocal about Isabel and why it is beneficial. In fact, one of my colleagues a few weeks ago called me and said, I have a problem on a patient and I want you to help me with your program that helps do the diagnosis. And so she gave me the problems or the symptoms, and we came up with a differential diagnosis that has led to being able to tell what the patient had. Using Isabel, we're able to get a much better view of where to go rather than just they come in, we order a bunch of tests, they come in again, we order another bunch of tests. We can save millions of dollars on the workup of many of these patients if we could target the tests based off of all of the data that's out there. But none of us in medicine can remember all of the data. The data is changing dramatically on a daily basis. And we need a program like Isabel that will give us that data at our fingertips at the point of care. As we become more and more specialized, there are fewer and fewer doctors that know the broad range of medicine. And if it's not a problem that you're seeing just yourself, that you see all of the time, you're less likely to be up on the current information, up on the current symptoms associated with that problem. And using Isabel really helps in pulling all of that information at the point of care where you can impact the patient's life.